Hey guys, welcome back to the channel. This is Dr. Zannis, and I want to discuss a sensitive topic with you today that's really important and a question I get asked all the time on my consulting side about aesthetic medicine. Whether you're talking about cosmetic surgery or even injectables and non-invasive things, even med spas, price is always an issue and it comes up frequently when you're talking about high dollar items. So I want to do two things today. Number one, tell you why I charge what I charge for my surgical procedures. And then I want to tell you and help you understand how you can deal with this issue when patients are asking you, why does it cost so much?
Never stop, get it if I want it. Gotta make to myself a promise, I won't quit.
So why does it cost so much? Why is plastic surgery so expensive? And I'm talking about cosmetic, out-of-pocket, elective surgery, not reconstructive or anything that insurance would cover. So there's lots of reasons. Sometimes it's regional. It depends on the cost of living, just like anything else. Restaurants and eating out and things cost more in certain parts of the country than others. And so, of course, that will go into consideration. What type of facility you have, how expensive is your overhead, how big is your staff. All of these things go into determining how much a surgeon charges for a cosmetic procedure. Nevertheless, there should be a relatively average cost in most regions, or else it's impossible for a patient or a consumer to navigate the area of price if you've got thousands and thousands of dollars of difference between the lowest and the most expensive price for the same procedure. For example, breast augmentation is a very common procedure, and it is also probably one of the most price matched or price researched procedures there is. It's more of a commodity in the way it's perceived by patients, although I don't agree with that at all. It's perceived as something that should be pretty much equal and basic, and anyone can do it if you're a plastic surgeon. So they call around and they shop for a good price. Now, that's a bad thing to do overall. You want to know the price, you want to have a good idea and understanding, but primarily choosing your surgeon based on the cost, it's obviously going to lead to unhappy patients, unhappy doctors. This is a medical field that it is commoditized, but it doesn't necessarily mean that that's the right thing to do. So, having said all of that, breast augmentation or implants is commonly a sought after procedure and one that people will shop around for. So the range could be anywhere from $4,000 or $5,000 up to $15,000 for just standard breast augmentation, which seems like a pretty big range, but I would say the average in most places is going to come in around $7,000 to $8,000. Now, how do I choose what I'd like to charge in my practice? So all the things I mentioned before, facility, overhead, staff, that all goes into consideration. But the way that I really determine what I'm going to present to a patient for the price is essentially going to communicate to them what value do I place on this service. And I think that all of our services are of extremely high value, and I do not cut corners, and I do not, try to undercut competitors, so to speak, or other surgeons. I don't really even seek out a lot of information on what other people charge. I know the basics in the ballpark, but I find that if I look at what is our fixed cost and how much it will take to do the procedure and a little bit of markup for a surgeon's fee, of course, because you don't want to work for free, you can figure out how much is your hourly rate. What do you think you should be paid per hour, and include that into the total price calculation. Now, like I said, we are not the cheapest around. I don't charge less than everyone else for my procedures. I'm not the most expensive around. And, some people say, oh, you should be the most expensive because that shows that you're the best. Well, that's artificially inflating your prices. And a little bit shady, sure, it might be fine, but people know if it's worth it or not. People can figure out if you're a quality product or not. Definitely, you don't want to be the cheapest because that means you're barely making, as a business person, uh, enough of a margin to be successful. And it also does speak poorly of how you value your service if you think that rock bottom prices is all that you can get. So it's a complicated thing, but we charge what we charge, which is middle to the higher level of cost because number one, we don't cut corners. We do not eliminate expensive components of a surgery to save money if they are essential to a good outcome and to a safe procedure. So, for example, you talk about a state of the art surgery center, which we have here at our facility. I do not spare any expense on patient comfort, patient safety, quality of our monitoring systems, of our medications that we use, the operating instruments and the table and the uh, bed warmer and all that kind of stuff. You don't want to cut corners and have faulty equipment. So we don't spare expenses on that. We have sufficient personnel and plenty of staff to make it a very good, efficient process that you're comfortable with. So number one, you don't cheap out when someone's well-being is on the line. Number two is we are not a factory. There are factory models where people come in and out all day long, and you're just trying to be as efficient as possible and as quick as possible. You don't even know the patient's names. You don't talk to their families. I mean, it's just a conveyor belt. It's sort of like the assembly line model. That is a recipe, number one, for unhappy patients, and number two, for mistakes and complications. And I don't know if you've ever experienced that kind of a thing in a physician's office, but if you have, it's very disheartening and it doesn't give you the sense that they really care about you as a person. So we spend the time so that you get the best care possible and you feel that you are getting the sufficient time and attention for the amount of money that you're spending. Thirdly, and I don't mean to boast, but we are top notch, and I do have a reputation, which I've built over many years of hard work. We are a quality establishment, okay? We are a quality practice with proven results and proven longevity of results. So once you have a proven product and it's been tried and tested and there is sufficient time on the market, so to speak, to be evaluated by plenty of consumers who can attest to the quality and to the durability of that product, your stock goes up and the price is inevitably going to be higher because it's worth more than an unproven product, i.e., a new doc on the street who just set out their shingle and is, Joe Schmo's plastic surgery practice. I did that when I first started. All independent solo practice doctors have done the same thing. But with time, you build your name and your reputation based on the work that you do, and then your product is more valuable. So we are a quality, proven product. We charge accordingly. And finally, to wrap this up on how we determine what we charge, there's just one of me. There might be large practices where there's multiple partners and each person charges the same or each person charges different amounts based on how long they've been there, if they're a partner or just an associate. I'm in solo practice and it's just me. So the price is the price, always the same because there's just one provider and I am in high demand and short supply. So supply and demand, like everything else, does contribute to the determination of cost. So if there's an abundance of demand for your service, it will invariably increase the value in what people are willing to pay to obtain that service. So that's just basic economics. Now, having explained all of that for you guys on the business side in aesthetic practice, and if any prospective patients happen to stumble across this video and are curious about how physicians like myself determine what to charge, having explained all of that, I want to tell you that you should never feel obligated to justify your pricing. And I mean for a product or a service of any kind. You do not have to justify, and you should not justify your pricing to the patient or the consumer. But you will have to broach this topic. You will be approached by patients several times, maybe even several times per week, asking, why does it cost so much? And it's a very uncomfortable situation, especially for certain character types like myself who do not like confrontation, do not like to feel salesman-y. And, there was a time when I would just really avoid that discussion as much as possible, or get angry that they're questioning if I'm worth it, or get worried that they're going to go somewhere else if they don't think it's worth it, or maybe this immediate desire to just lower your prices and say, okay, I'll cut it down. All are bad practices, and you learn that as a more mature physician, as a plastic surgeon who has been in private practice doing cosmetics. And cosmetic surgery is a whole different world than recon, okay? But as you guys know, but you will be approached with this question often. So how do you respond? Hey, before I let you in on how I respond and how I think is the best overall practice for dealing with this question, I'd like to ask for a big favor, and please subscribe to this channel if you are not already a subscriber. I hear the same kind of requests for subscribers all the time on YouTube because I'm a huge consumer of YouTube content, and I realize that it is super important and a lot more helpful than I ever knew before I became a creator, that those subscribes and likes really allow you to keep going. So please do me that favor and subscribe so that you can be part of the inside team that's going to get all my future videos alerted to you when they pop. All right, so getting back to what you are supposed to say to that patient that asks you, Doc, I want this so bad. I know you are great. I've heard good things about you, but it is too expensive. It is so much more than I can afford right now. What do you say to them? Because you want to help them, but you also don't want to just drop your prices to where you're not making a living. So first thing to do is not get angry. Understand that everyone has an emotional response to money. Sometimes it is out of their control, and you should respond with a steady demeanor. Do not get angry. They are not questioning you. They are not suggesting that you're not worth what you are asking. They are just looking for some type of an explanation, some way to make sense of it, and most likely some sort of a discount as well. Recognize that any type of a price when you're purchasing something, a service or a product, is essentially a form of a negotiation between the seller and the buyer. It's always a negotiation, and if both parties are interested in making the transaction, there is good hope for a deal to be made. Now, what you don't want to be doing is haggling. A plastic surgery office is not a flea market. You're not going to be trying to get a sale. So you cannot lower the price, but what you can do is find a way to work with your patient in a way that will help them to satisfy their budget and still get a service that they feel is valuable and worth it, and helps them achieve the goal that they're looking to achieve. What I mean by that is rearrange your offering. And I do this all the time. I'll talk to a patient about something that I think is their number one best option to achieve a goal. Like, let's say they need a facelift, and a facelift is one of our most expensive procedures. And they want it, but they say, I cannot afford a facelift. So I start looking for alternatives, maybe a mini facelift, maybe a neck lift only, or if it really comes down to it, non-invasive ways to help them feel better about themselves without going through with the full facelift procedure. So sometimes we'll end up saying, well, what's your budget? And when they tell me a budget that's, 10% of what a facelift costs, I automatically know that they're not in a position to uh, afford that and are not going to really want to discuss surgical corrections any further. So I started saying, well, how about non surgical? How about laser? How about microneedling? How about radio frequency? How about things that can help with the texture and surface quality of your skin and make it look smoother and better? Botox, fillers, without doing a surgery. Now, they're not equivalent, and so you have to make that clear. This isn't an equal exchange, but it is an option that is still going to help you feel better about how you look, and it is a lot more affordable. Another thing you could do is add-ons. So here's this facelift, and here's the price. They're questioning the value, and you might say, "Well, why are you questioning? What's your concern?" And maybe they think they're not going to get enough of a result. So there's teaching, there's reassurance, and sometimes there's adding in additional services that will make it a better deal for them. So I'll say sometimes to people, you know what? Let me add in a free chemical peel a month after your surgery, or we can do a laser, perioral laser or dermabrasion or something to address this other issue that you have that the facelift itself will not, but it'll be at no extra cost. And so it's a way to seem flexible and to actually be flexible with your patients, to show them you care about their financial well-being and their concerns, the legitimate concerns, but still without really dropping the price from person to person to person like it's some sort of, I said, a negotiating environment, a used car shop or a flea market. And the final piece of advice that I have is if you are having a hard time in addressing these questions, remove yourself from the situation completely. I used to always present my patients with a quote because I thought, number one, they appreciated that. And also, it allowed me to directly respond when these types of questions arose. But my life is a whole lot better and simpler since I stopped doing that and allowed a patient coordinator to deal with all the financial stuff. It really does help to eliminate yourself from. I'm not saying, you know, I just do the surgery and I don't know what the costs are or anything like that. Of course not. I run this business. I'm intimately familiar with the fee schedule. However, by not having to be the one who is presenting and answering questions, it gives me more time, which is awesome. And it also creates a separation that is easier for patients to understand, okay, this is not a negotiation, and also for the patient coordinator presenting the price or the quote to say, look, I don't have any power to give you a discount. I mean, the price is the price for everyone. We try to be fair, but that's the quote. And so it just makes it simpler. It's kind of like, I think, what's that place called? CarMax, who they don't haggle. It makes it easier. I bought a car once from CarMax a long time ago when I was in residency, and it's well known. It's printed, on signs, no haggle policy. So when you go in there, this is the best price that they're going to offer, and there's no expectation for negotiating a lower price. It makes it easier and in many ways less of an anxious scenario when you come to the portion of the visit that deals with cost. So I hope that's been helpful to you. I know we are medical professionals, we're doctors, we are in this business to help people, but it is still a business that must be financially sound, and it's often a very uncomfortable topic. Money is often uncomfortable in the realm of medicine, but it's important in order for you to be successful, to expand, to be happy and have a long and fruitful career, you got to be smart when it comes to money. So the two takeaways are why we charge what we charge and why you may very well be able to explain to yourself or to anyone who you think you should be explaining how you arrive at your particular prices. But more importantly, is that you should not feel obligated to justify your prices or your self-worth to anyone. If you feel ethically sound and solid in the decision to charge what you charge, then dealing with those questions should be simple, and it should be a matter of let's work together, but I don't have to explain to you why this procedure by me in our facility is worth what we're asking it's worth. So I think that, it's complicated, but maybe my 2 cents will help you out a little bit. I appreciate you listening. I appreciate you guys following this channel. And once again, please subscribe, like, leave a comment, ask me any question. I read them all and I will respond right away.
Never stop, get it if I want it. Gotta make